Hello, good afternoon, good evening, good morning. I can't see anyone out there, so we welcome you wherever you are in the world. It's really great to have you here. I'm Amir. I'm a former journalist. I live in Israel, and I've come across Eleos Health, which is a company that looks into innovation in mental health care. And I'm very happy to be here today with two guests to talk about the mental health pandemic. First off is Dr. Shiri Sharvit, who's a clinical psychologist and chief clinical officer at Eleos Health. And also joining us is Dr. Simon Rigo, Chief Psychologist, Director of Psychology and Behavioral Therapy Training at the Montefiore Medical Center in New York. So I was hoping that I could just, we'll start off with just kind of brief introductions and we'll take it from there. Shiri, I wanted to start with you. What is a chief psychologist and clinical officer do at a startup?
That's a great question. Thanks, Amir. And hi, everyone. Thank you for joining us today. For me, the role of a chief clinical officer is actually a dream coming true because as a psychologist, as a researcher, as a visiting instructor at Stanford University, I've been working with many tech companies to implement their tools in my studies, guided self-help programs and apps for patients mostly with eating disorders, but also with other mental health conditions. And while the tools and the digital platforms were really great, I always felt like I needed something extra from them that would be more tailored to what my specific needs in my clinic and my clients' needs. And then I stumbled upon Eleos Health, or Eleos Health stumbled upon me. Depends who tells the story. It's like my story about dating my husband. And here I am. So my role is really representing and advocating for the consumers who are the psychologists and the clients, as I'm an active clinician, have seeing people regularly in my practice. I sense the field and I hope that I'm able to communicate the needs to the tech side of the company.
Yeah, it's amazing, you know, and as a person who used to cover the tech industry, to see kind of more doctors and therapists and people concerned about our wellness in it is, it's great. It's great to see. Thank you, Shiri. Dr. Rigo, tell us a little bit about this group that you've started, CBT. There's 58,000 people on it. What's going on? This is huge.
Yeah, and as well, thank you so much for having me today and start this discussion, which I think is so important. The CBT group I started a few years back because I'm passionate for CBT. I'm a clinical psychologist I work in the Bronx, New York, and I was trained formally as a doctoral student in CBT 25 years ago at a time when it was still a little bit of the new kid on the block, especially in New York, where there is a large group that is still practicing more traditional forms of psychotherapy in the spirit of Sigmund Freud. So the beauty of CBT, I think, is the world has grasped its potency as an intervention. Right? It was born out of the laboratory, so it has risen out of clinical trials that have looked very specifically at not only why we think it works and the mechanisms behind it, but also how it works and for whom. And the trials that have been done are so potent and powerful that I think the world has really embraced its utilization as a tool that's comparable to medications. So I formed this group on Facebook, passively just saying, I wonder if anyone else is interested in this. And then lo and behold, you can see what starts to happen. We have a great group of people who I really appreciate those that are joining us today that get very involved in this group, posting referrals and resources, and it's been a real treat.
And it's almost like the innovation is happening through the community, because these kind of things didn't exist before. I'm assuming, where people could come and learn from each other and ask each other things. I'd like to start to move to this idea of where are we now in the mental health pandemic? And for people who, maybe haven't heard of that mental health pandemic, this is the first time because of the COVID pandemic. There's a lot of anxiety in the world, a lot of that kind of stuff. And I'm wondering, do you have a view on where we are? Are we at the beginning of the end of the mental health pandemic because of now there's a vaccine coming, or are we just still at the beginning?
I'm sorry, are you framing that? Is this for me or is this for Sherry?
Sorry, let's go for Sherry first.
Okay, thanks. Although I'm really interested to hear what Simon has to say about this. I think that maybe one of the unforeseen benefits of the COVID-19 epidemic is that there's more transparency about other mental health and health situations, about the need for affordable care, for universal health care, and also for the fact that many individuals do suffer from mental health issues. A few days ago, a report was published on Lancet that among 65,000 individuals who had COVID and had COVID registered in their electronic health records, between 14 to 90 days following the update of the COVID diagnosis, they had at least one mental health diagnosis that was new and didn't appear before, as we can assume, mostly had either an anxiety disorder, insomnia, or dementia. And while, some individuals with whom I spoke about this were very surprised, I was not that surprised, because we know that about 46% of the world population will experience a mental health condition in their lifetime. So I think that the pandemic is real, and now we have the legitimacy and hopefully also the tools and the resources to talk about it.
Interesting. So it's interesting that you said the pandemic is real. And Simon, if the pandemic is real, do we have enough, let's say in the US, for instance, do we have enough therapists and people to help and to stem this, to fight this?
First of all, I agree that it's definitely real. And I think the pessimist in me says, no, we need more. You asked what stage are we in, and you can see where the numbers are going globally. So I don't think we are through it at all. And most typical in things like this is you have, first of all, the first round is all the medical problems that happen. We pay a lot of attention to the mortality rate, or how many people have died. We pay relatively less attention to what's called the morbidity rate, people who live but now have medical compromised systems because of COVID. They lived, but they have aftermath of that, sometimes for weeks or months. We don't know yet. And then even larger footprint, that's still a lot of unknown, although as Sherry mentioned in Lancet, people are looking very closely at what's going on. You have the mental health toll of this. But at least here in America, where we're likely heading towards even more restrictions and more stress in our country, and the numbers are going up, so we'll see more loss. We are, I think, early on in trying to prepare for this, and the numbers will just grow. So already prior to COVID, we had an imbalance between demand and providers to help with it. So I think we're a long ways out.
And so I'll follow up then with an imbalance between demand and supply. Are there technological ways for therapists to now start to address that imbalance? So, Simon, I was asking you, I was following up with what you were saying.
Sorry, thank you. Yes, I think if there's a silver lining in this pandemic, is that it has forced systems, healthcare systems, governmental systems, political systems to look at how are we going to address the needs, the demand that's rising, and already there had been a building movement in the research around how you could utilize technology to help disseminate treatments, to help people with access issues, to help overcome stigma, to reach people who may not have transportation, who may have parenting duties or schedules that don't fit nicely with traditional systems. So I think the short answer for me is absolutely we need to do more with technology. We're being forced to do more, which is good. A lot of the regulations in our country have been loosened to help use and facilitate technology in our treatments. So I'd be really curious to hear what Sherry has to say as well, and also platforms like Eleos and what it can do to help augment treatment or enhance the care that's being delivered.
Yeah, let's ask that. And Sherry, in your work and through the people that you're talking to, are you seeing examples of therapists using more advanced technology to kind of, to help out and to really address this? What are you seeing?
Yeah, I'm seeing, I think that I'm not seeing enough use of data. Simon mentioned earlier, being trained in a context that primarily relied on psychodynamic schools. I was also trained in that context where you rely mostly on your intuition, your assumptions, your training, maybe if you're lucky, your supervision or your consultation group, but we don't rely really on data. We know the client's mental health status based on what they describe and how they show up in treatment. So, if someone had a fight with their boss prior to arriving to the session, it really changes how they interact with us many times. And if we really want to make treatment scalable and provide these resources to the numerous number of individuals who need them, I think that we'll really need to include more automation and more data.
And so it's interesting because you wrote an article, it's on I think on the Medium, and we can put it in the group, where you basically said that it's time for therapists to start using doctors like data. Start using data like doctors do. If I go to a doctor, they have all of my medical records. I can even access them. But when I go to a therapist, they don't have that. They don't have that. I guess maybe it's in written notes, right? Is that still mostly like that, or are you seeing much more of an uptick, Shirley?
Well, right now, therapists are overwhelmed. All the therapists that I know have a long wait list. Actually, right now, I don't have anyone to refer to because people really want and need mental health support. I think that if there would be more bandwidth, people would be more open to learning new tools. And I think that they're so overswamped right now with work that they are many times unable to find time to learn new tools, which, ironically could help them save time, save money, be more efficient, and focus on their clients and make treatment more relevant to their clients. So unfortunately, there's much to do.
And so it's interesting, and Simon, I would want your perspective on this. As a patient, I will have, my phone to I'll be able to put my moods, how many times I've walked or exercised, how much I've eaten, have I spoken to friends, or have I been alone all week? But when you come to that 1 weekly hour with a therapist, they don't know any of that, right? Is that something that you think they should know? Is there a responsible way to add more information to the therapist? Empower them?
You're preaching to the choir, and I think your question is leading, but I'll take it because I agree with you. So, and Sherry's point is well taken. I think the problem is our field still traditionally doesn't like necessarily people peeking in, right? And people are busy, so it's hard to learn new things. But I agree that we have reams of data now with smartphones and other technologies, Fitbits and things that could tell us as therapists objective data that's ecologically collected in the moment stuff that we could use to augment what we do. If we could embrace it, I'm a firm believer that this could enhance outcome. And I also think that by using our skills to summarize and have that inform how we think about what's going on in the patient's life to perpetuate their symptoms, we can collaborate with the patient, share this feedback in a way that's helpful alongside of what we do as a therapist, not instead of, but alongside of it to enhance it. And then I think patients seeing the data back to them actually become motivated to make changes in their lives more readily, because they can see what you're doing with it. You can present it back and show them how you could use it to help make adjustments in their lives, and then they can realize real gains, and that makes everybody win.
Right. So I mean, that's really interesting to me in terms of, of getting all this data and analyzing. But do you think that therapists now will have, the bandwidth to handle all this data, or is it, is that maybe something that's keeping therapists back, Shirley?
There's a lot of data going on, coming from too many resources. I believe that, just like when I go to my bank account portal, I see a landing page with the summaries of what's going on in my checking, saving, etc. I think that this is where psychology and psychotherapy is heading, behavioral health in general. We are part of healthcare in general, and analyzing all the data, hopefully with more automated platforms, would be, I think, of help.
So on that, so the Eleos platform, can you tell us a little bit about kind of how it helps the therapist? What are they actually seeing on it? How does it work?
Sure. So Eleos is a really unique and neat platform for therapists. It's an AI artificial intelligence and platform that is based on sophisticated machine learning protocols. And what we try to do is help the therapists connect more with their client and use more both objective and subjective data in order to understand where treatment is heading and what their client needs are. And we do it by using session recording and analyzing the data that is communicated in the session. For instance, silence episodes, and whether the conversation is flowing like us here, or maybe there are too many silence episodes, or the therapist is unable to prompt the client to respond, or maybe the therapist, we see that with young clinicians, has a lot of data information they want to drill into the client, and then they speak for longer durations of time. And we integrate that with data that comes from the client. We ask clients to complete weekly assessments, and all this rich data is being analyzed, summarized, and visualized to the therapist so that they can understand what's going on. In addition, we also provide automated notes because we know that note-taking on your EHR is a very tedious task, and have other really cool features.
So I want to try and take that to the scene at Montefiore, in New York. And New York was hit very, very hard. Can you tell us a little bit about, how therapists that you guys were seeing in New York, and how people were working, and were they using any kind of software tools, or were they just doing things just as fast and as best they could?
It was, no, thank you for that. And, you know, it was in April, May for a while, we were the literal epicenter of the whole pandemic. And here in the Bronx, which is a borough of New York City, our population was disproportionately affected because we have a largely underserved, poor community, very diverse, underprivileged population. And the data is there that disproportionately our community got hit hard, very hard. So as a system, we were at our peak seeing 2,000 new cases admitted a day, which was not only incredible in our system, impacting our community, but the providers in the system, the frontline providers in the emergency rooms, the intensive care units, are people too, and they weren't used to seeing this. So the whole system, it was like a tidal wave coming through. Means that for a while, to be honest with you, everyone was just scrambling to adjust the needs of the community and internally our colleagues to help them.
Wow.
And so it was more like doing what we could, but now that it's settled, June, July, August, we had time to step back and say, what are our lessons learned? And certainly we've been learning about ways that we can be more efficient in our delivery of services, including things like varying technological platforms and to reach patients and also to help treat the people that are treating the patients, if you will.
Yeah. And Shiri, from where you were looking and you were watching what was going on, any observations?
Yeah, well, you know, an anecdotal observation that we had when reviewing the data, that treatments dramatically changed in March, whereas before we assessed the speaking ratio, how much the therapist, how much the client speak at any given treatment session, and it's about 50 to 65, 70% of the clients speak. And during March and April, we saw that this was completely out of balance. Patients were talking 85% of the session, 90% of the session, and think what happened. People got furloughed, students were sent home, they were worried about their relatives, they had a lot to process. Many of them did not have access to other social network supports, and it was really interesting to see that therapists were mostly taken aback by the experience. And with many individuals with whom we worked, we offered the therapist, maybe they would want to include also an app to support the client between sessions. For instance, clients who started experiencing insomnia could be prescribed Veterans Affairs app of CBTI Coach, for instance. And I thought this was really interesting to see that patients really wanted to speak, but also therapists often felt, because they were experiencing the very same thing, not often had the tools to provide or what to say in response. And in about May, it kind of evened out and went back to pre-pandemic levels. But I thought that was really interesting. I don't know if Simon experienced that as well in his, in the big practice that you manage.
Yeah, no, I think you're exactly right. And I think where I was going to go with that too is there's the beauty of it is there's a plethora of tools available. I'm glad you mentioned CBTI Coach, because back to Amir, when you mentioned earlier, like, what do you do when you have all this data and all these metrics coming in, and it's like it can be overwhelming, and people who are new to it might then just back away from it. But building on what Sherry just said, if you can just take one, you don't have to use it all. You could pick one metric, like say insomnia, and that is such a robust predictor of treatment outcome or relapse. Or if you can use that data from just sleep and target that, or any other one you choose, and stabilize that by having an objective measure of that, some sort of routine outcome measure, give feedback to the patient, then you start making inroads, right? Then you have information in real time to see, is this person's sleep improving? And if their sleep's improving, maybe their symptoms of stress, depression, and anxiety also improve, because it's bidirectional.
So I'm wondering if that's a way that that your hospital can try and connect with, let's say, people in the Bronx or other communities who maybe in their mind, when they think therapy, first of all, they might not even know what kind of different therapies exist, and if they do have a picture, maybe it's like the Upper East Side shrink psychotherapist, and that's once a week, it's hundreds of dollars. How do you now look at that community? How do you reach out to them? How do you help through CBT and digital to connect with this community?
Yeah, I think that's part of our work, because I think there's still a misperception of what psychotherapy is about, and a misunderstanding of what's the difference between a psychiatrist or a psychologist or a social worker or a counselor or a psychotherapist. And then there's still, unfortunately, even though it's 2020, there's still a lot of stigma in certain communities around going and talking about your mental health to a stranger. Some things, some families don't want it, or cultures don't want you talking about your mental health issues or even acknowledging the impact of mental health. So I think the pandemic, fortunately, is tearing down a lot of those boundaries, and people are being confronted with either new mental health issues as a direct result of the pandemic, or previous mental health issues that are being intensified because of the mental health pandemic, or medical conditions that are being exacerbated. So we have inroads now to tell people it's normalized, legitimized when people are struggling, to link what might be physical complaints or like sleep complaints and say, well, maybe it's actually tied into how your mental health is doing. And we can message around that to draw people in. And then we can utilize technologies to try to disseminate it back out for those that might have trouble accessing this.
Yeah, I mean, I find that's probably the biggest focus and challenge going forward, right? We had this initial wave of people, and now they've all gone back to the communities. Is there something about CBT specifically as a practice that lends itself to data, to software, to measurements, as opposed to to other forms, Simon?
Yeah, I think, as I said, CBT is born out of the research clinics. So there's a lot of operationalization, it's called, taking our concepts and defining them in ways that are measurable. And much like medication or pharmacological trials, we had to have standard scales to measure, is what we're doing it the way we think it's doing, and objectively measuring outcome. And that's where all the routine outcome measure or self-report measures come in. So CBT lends itself very nicely to a objective, almost manualized approach that we can then say very clearly, we think it's working because of this, and it's working better than a placebo or another form of therapy, because we can compare the two in clinical trials.
So just as we kind of head towards the end, as a former tech journalist, I would love to know what you're seeing as kind of like the cutting edge, cold face, what's coming next in I guess the innovation around the delivery of CBT. What are you seeing that's almost kind of experimental in a way?
I'm gonna pass the baton on to Shiri, because this is gonna sound like I'm patronizing the group, but I actually think Eleos is what's next. I think it sounds like such a setup, and I would have, if this was any other conversation, I would have said this exact same thing. We need to use the technology to enhance what we can do, be it for dissemination, be it for training, so that we actually know, is someone who says they do CBT actually doing CBT, to be able to look at that. In all the trainings we do, that's one of the big obstacles. When people go back to their offices, do they continue to do what they were trained to do? And by being able to look in and analyze, we can say yes or no. And then to be able to use dashboards where we can get data synthesized in readable ways and then give that back to the patient. AI and these platforms, I think, are going to be critical for training and dissemination and enhancing what we do in treatments. And I'm not just saying that, but I'll let Shiri build on and take the final word on that.
Thanks, Simon. I couldn't agree more. There's a beautiful paper by Glenn Waller in the eating disorder world, where they interviewed clinicians and really tried to analyze what they're actually doing in their practice. And the title of the paper is "I Know What You Did Last Summer, and It Wasn't CBT." really a great paper. And I think, Simon, you talked about the therapist drift, and especially when the therapist is activated and triggered by the same factors that bother the client. I think this could cloud our judgment at times, and it's really good to rely on data of both what's going on with the client and what we're doing and how we're delivering the services in order to assess if we're providing the most effective tools to the clients.
Well, I mean, I could tell you, I could go on for hours with both of you. I find that this is just, very, very important. This has to happen, in my opinion, a responsible innovation in mental health care. So we have to wrap up, unfortunately. I'd love to do this again. So I'd like to thank Dr. Shiri Shalvit from Eleos Health and Dr. Simon Rigo from the Montefiore Medical Center. Thank you so much to both of you. We hope that you and your networks are able to just grow and help people. Thank you very much.
Thank you very much.